Kentucky leads the nation in cancer rates and mortality, according to the National Institute for Health. That's in part because of the high rates of cancer in eastern Kentucky. One program at the University of Kentucky is empowering students from the area to be part of the solution. Appalachian Kentucky Career Training in Oncology, or ACTION for short, has trained more than 150 students from eastern Kentucky in cancer research and care since 2016. We hear from some of those students in tonight's look at medical news.
The program is all about giving high school and undergraduate students from eastern Kentucky opportunities to get training in cancer research and oncology healthcare experiences. They get an opportunity to conduct hands-on research in really any of our world-class cancer research labs. They get opportunities to shadow clinicians, observe in clinical settings, and that can include in the operating room, in clinics, and other patient care settings.
Honestly, I saw it as the best way that I could possibly give back to my community. It just seemed like it was constantly someone telling you about their cancer diagnosis, or someone was passing from cancer because they hadn't sought the help that they needed, or they just didn't have the access.
It can be argued that there's no other state in the country that has a cancer burden like we have in Kentucky. What's worse is that those rates are greatest by a significant margin in eastern Kentucky. So we really need people from that area to be interested in and prepared to pursue cancer-related careers, because those are the people that are most invested in this issue, because they have family, they live there, they have family and friends that live there. So we need those people to be invested and prepared to pursue oncology careers to help us solve this problem in the long term.
I've known people my entire life that are afraid of the doctors in Appalachia. Typically how it goes is a lot of people in Appalachia wait till the last minute to go and seek treatment, seek help, figure out what's going on. So it's the mindset, if I go to the doctor, I'm going to die. It's a death sentence.
We know that medical mistrust is very high in rural communities. And so that's one reason why it's really important for us to train these students, get them prepared to pursue healthcare careers, because we know that healthcare providers from the areas in which they serve, there's much higher trust.
There's such a stigma on Appalachians because people are like, they are doing this to themselves. But if you're an Appalachian yourself, you understand what's happening in these communities. You're seeing how poorly we're treated, and you're more likely to understand and actually help these people, and you're not going to see them as a paycheck.
It is very important that Appalachian students get the opportunity to realize that just because they're from small towns, or just because they are from Appalachia, that they can still become something and they can still make something of themselves. And oftentimes, well, I know every student that has come through the ACTION program has some kind of cancer story themselves. So it's important that they realize that not only can they become something, but they can be the person who comes home and gives back to their community and is able to make a difference.
Students in the ACTION program also get to publish writing about their experiences. Dr. Vanderford and his students have released 3 books about cancer in Appalachia, and a 4th is expected to be published later this year.